Hello, Dr. Shabazz.
Yes, sir. Can you hear me?
Yes, of course.
Okay, that's good. That's good.
Wait a few minutes, we will start soon. I'm waiting for chairs.
应该是这个，你看能不能？
人也不少了。
对，你能不能叫那个人的把这个调一下？
刚才已测试我叫林过来调的。
对，因为他量了这个以后可能有问题。哎，可以了。That's okay. हाँ, okay.
मैं कह रहा हूँ कि उधर मार्की में कैमरा लगा दो, सेशन है 4 बजे तक। जी
你轻一点。
没事。
可以。把这个等会儿我们就出效了，这个两个那一点就可以。
那我就按这个先进就行了。
对，你这个
先进。
我等会儿告诉你 ，OK。Mr. Lee。
做好了你说是吧？
Yeah， 那他们有主持人，我也是这边。Professor Lee Hao, we are waiting for Professor Lee Hao. We're trying. Yeah.
弄好了，把会议室需不需要看一下？
对，
用点手机和你学了。一会儿就看 PPT 了，啊，
对，可以。
Johnny.
सर मैं आ रहा हूँ सर मैं आता हूँ.
Yeah, Professor Lee Hao is here. Sir, could you please adjust your camera a little down?
Oh, okay, I see. Okay.
A little more down, because it's going upward. Yeah. Okay. Yeah.
Okay.
Yeah.潘总，我发给你这个，你进去，你4个人，对，不同的地方。Vijay, you want to join the conference? Separate? I can give you my. Huh? Yeah. Yeah.
用你的手机再切出来一个。
对，我的手机。
然后把那些支架弄过来，然后我们几个人坐到那边。2个小时。
好，实现。我们想人，我们人少是吧？他们人多可能是。
我们两个正常，一个远景，一个近景。
这是现场，这网上还有人啊，是吧？
完全还有人，他们有 live on the YouTube also。
Recording in progress.
没有说。
Yeah, but my understanding. Use the backside camera. 你打扫一下这个太不干净了，用 tissue paper.
OK.
Use it. 太高了，
太高了，太高了。
对。
不行，咱们人太少了，是吧？多个人也多人。
还有，你可以到这儿。
说的时候。
一定你最好是你们两个人做。
那没有，一个人。
对。
我说那么离我们这儿吧。
现在我们人还多一点。
你不行，你穿你的那边。You move to your side. 对。
人多你看。
और वो इमरान किधर है इमरान किधर है उसके पास शकील सादक वाला कैमरा है इमरान के पास शकील सादक वाला कैमरा है उसको कहो कि उसको दे सादक ने जो शकील सादक ने जो वो इमरान के पास है उसके बैग में है उसको कहो कि उसको दे शकील सादक
Recording is this way.
咱们前面还有一个报告是吧？
对，应该有对。OK。
安一个人过来。
你可以看两个人，
三个人。
两个人可以坐一会儿。
人多，咱人少。
你坐前面，这里面看不见。但是你坐这边。
Dr. Shahbaz?
Yes, sir.
Can you hear me?
Yes, I can hear you. Yeah.
Okay. So let's start do a ceremony with the recitation of Holy Qurans. Before starting, I recite few verses. Bismillahirrahmanirrahim. Inna atayna kal kawsar surah rabbika wanhar. Inna sha'anika huwal abtar. Ladies and gentlemen, today sessions, the topic is health technology and medical educations. We have a chair, Professor Dr. Amar, Professor Dr. Inam, Rawal Institute of Health Sciences, and the keynote speaker, Dr. Aisha Sani, and hopefully Dr. Shahab Naqvi will join us soon. Today we have 4 speakers, and let's start. First, we have a shortage of time. We start with Dr. Aisha Sani, who is a keynote speaker of today's sessions. Before she delivered the lectures, I want to introduce Dr. Aisha Sani. Dr. Aisha Sani is a program head, National Aid Program, Islamabad from October 2020 to present. And he was also a focal person, breast cancer awareness campaign, Ministry of National Health Regulations and Coordination, Islamabad, from September 2009 to present. And he's also head of center, deputy project coordinator, and federal breast cancer screening center, PIMS Islamabad, from 2013 to present. He was also a professor and head of department of radiology, Pakistan Institute of Medical Sciences, from June 2003 to present. And now we request to Dr. Aisha Sani to present their presentations. Over to Dr. Aisha Sani. Thank you very much.
Thank you very much, Chair. Thank you very much, Dr. Tariq, and all the participants for being. So my lecture is going to be different. It's not going to be like the lecture thing. I work practically. So I am a professor of radiology, and then with my public health exposure of I've got a PhD public health. But the interesting thing is that I decided to work. I work both in non-communicable and communicable diseases. I've done a master's in medical education, and coming from these diverse backgrounds are some experiences. Actually, what I'd like to share with all of you, and I think that is what you should all take home. You don't have to be a pediatrician, or you don't have to be a gynecologist. That's a step one. Or just a public health even. Why not have a MPH and a MHP? Why not together? Why not go ahead? So I see a very young crowd here, and I think that's the most beneficial part of today's day. People who can have take-home messages from me, and I'm there. I'll be available. My number will be available with Dr. Tariq. He's a good colleague, and I'm there to guide you all. That is what I really want to say with my heart. So let's get ahead, and let me give you an overview of what we are really working on ground. Next, please. So this is just a general thing for all of you. So what is health technology? So health technology is application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, and systems developed to solve a health problem and improve the quality of life. So that is the end aim of the health technology gadgets. Next, please. Next, please. So a quick look. So what do we have? We have different health apps. We've got the telemedicine bit. We've got the hospital management information system, the laboratory management information, the radiology management information systems. These are things which we, a good institute cannot operate without. Then we have DHIS2. What is that? That is the District Health Information System. This is newly developed, and this is in collaboration. The hub is there at NIH, and we're getting information of 32 different diseases, communicable and non-communicable, from districts. In phase 1, there's 32 diseases, and we plan on expanding it further. So this is a big jump, and the credit goes to this, to the past 2 or 3 years that all of this has started happening. And of course, e-medicine, by which linkages are with, world is a global village, so with linkages with experts abroad, it may be in any field. And that is also a cornerstone which we've put in. Next, please. Okay, so let me share with you a health technology app. So what we have done in my capacity here in as Deputy National Coordinator of the HIV/AIDS program. So this is the iThemba Life app for HIV/AIDS, which we are launching now. We have gotten the grant from the Global Fund, and let's see what it does. And you'll understand how it can solve the rising HIV infection in Pakistan. Next, please. So what is iThemba? It's about time. So iThemba Life. So it's really getting down to the grassroots level. This is a Roche device. So what do? We support linkage to care by empowering patients. So empower this tarah. Like what we do is that we do tailored education, appointments, reminders, medical reminders, result deliveries. So they're having their tests. This is a very sensitive area. People are very, there's stigma discrimination. People are very hesitant of sharing that they have this sort of they have HIV. Honestly speaking, it's still, like the president just spoke up about breast cancer. This is another such domain in the communicable disease. Then we have facilitates clinic workflow, and this is really needed in the COVID thing. We saw initially last year disruptions in patient flow, March, April, May, and then there were massive lockdowns. Even the government then realized you cannot do that. So these apps and these facilities were developed for people to get appointments at clinics, so there is no crowding, and they can be looked after better, and the hazards to the workforce, the health workforce also reduces. And then, of course, this contributes to the success and sustainability of this disease, particularly. Next, please. So these are just different things. I've gotten this in my thing. My presentation will be available for all for information. So, these are things which just a telephone app, and the cost coming to us is $1 a year for a person. One of the most important questions, I think, is that what is the cost? So initially we got 26,000 people registered, and we will give this to them, and $1 a year. So you see the information they'll get. They'll get their reports, they'll have reminders, and whatever I said before. So you're going to give them this, and the patient confidentiality is preserved because a separate ID is given. You are not slotted in a certain disease or in a certain key population. You are just a human being who has a disease and needs to be treated like any other disease. Next, please. So the components, I'm not going to go into the small text below. So this is the cycle. So you see, you've got the Ministry of Health in one corner, you've got the clinics at one corner, you've got the labs at one corner, and the most important thing, your patient, the person in the yellow. So this is a cycle, and this sort of solutions, they connect all three. So as a government, I would be knowing that, oh, there are these clusters where these people have these diseases. Foreign would identify it on a dashboard. The laboratories would know that, they've got this number of cases. Your clinics, your doctors will be informed. So in one solution, the patient would know where to go. One of the biggest problems here is they don't know. They have a disease, they don't even know. So that information will also be given to them. So you see that this cycle we have, which technology has enabled us to integrate all components, all actors in this public health domain. Next, please. So benefits of telemedicine, I think this is you're very well aware of that. So you see that the geographic reach is increased, patients there's a big economic constraint. Believe me, even if the geographic is not there, people cannot afford the 20, 30 rupees even to get and just come for a screening, a regular screening. They will just come if they're very sick and things like that. These are just for your knowledge, and we all know that telemedicine, how much it can help, especially in these pandemic scenarios. Next, please. Okay, so now I'll touch on the other topic of our discussion today, was medical education. Being a student myself after recent medical education, so we see that there is so much need. So there are new training programs, there's expansion of curriculum, there is necessity of research work. No organization, no individual actually now is complete without doing some segment of research in their life. Next, please. Why AI, artificial intelligence in medical education? So I'm going to take you through a very interesting concept. So there's a lot of buzzword around the artificial intelligence, but the role is there in medical education. I think I would also like my colleagues here from the Public Health Academy. I think here at HSA also they need to start the artificial intelligence module here. Why is there need? Because there are rising public expectations. Everybody expects that your doctor should know everything. Honestly, when they come, so it's not you're a certain specialist. You know, you're asked a diverse set of questions. These are fed by social media, industry leaders, and medical practitioners. So everywhere. So it's a constant race against more and more information which is being released, increasing costs in medical education and healthcare. So that is the need has just created. There is a lot of cost. One student costs so much for one teacher to teach, and there is a limit on how much. We'll go ahead and I'll just tell you how we put it to practical use. So one of the problems being management and handling of large volume data in medical profession, while keeping confidentiality, is also being addressed in this domain. Next, please. These are all areas of improvement. So we you know, as we all realize, public health should be made part of the professional approach. And I think that this is the place where all of our specialities can get together and launch and reforms and innovations from this platform ahead. Even this artificial intelligence, it doesn't need to be speciality specific. Next, please. So let me tell you like 2 examples of medical education. So a classroom-based medical education, right? And then of course the community-based medical education, which was practiced in communities. Next, please. So what did we do? So AI system and tools can help to deliver precision medicine, be faster, effective, and accurate as human clinicians and improve delivery of healthcare. Current medical education does not prepare future physicians for the impending AI revolution in healthcare. I think most of you here, even if it was a first for me, let me tell you how. So next, please. It needs to be incorporated in the medical curriculum. We've got my chair here, I think is one of the inside team and one in the best position to implement this in the curriculum. And this is what we are also trying. So this is a tool, and when I applied it to my students, for example, they didn't realize because they weren't taught at undergrad level. It has to be taught at a MD, MBBS level. So there are things like cognition factor, ability factor, vision and ethics factor. I mean, students should know all these things. And these will only be known and the student can only be assessed if he or she is taught that in their undergrad curriculum. Next, please. This is just the tool to share with all of you. It's called a MERS tool. It is the new thing in, and for all of you to actually practice on and distribute amongst your colleagues. Next, please. So what have we done? So we developed a software for AI-based diagnosis of COVID-19 pneumonia. So working in a department where there was in a hospital, which was the hub of the COVID-19 pandemic at Pakistan Institute of Medical Sciences, I realized that, the work was so much, even like 40 people couldn't even cope up with the thing. And every next day, the person used to come that, oh, my patient's X-ray, oh, my patient's scan was done yesterday. Why don't I have the report by now? They're very serious. So, so we won a research grant and then we did this and we developed a tool. So at least a provisional report is generated. So you see, this is the way ahead. All of us just alone cannot cope up with the amount of work on healthcare professionals. And similarly, for breast cancer or mammograms. So everybody says awareness of breast cancer. So when the people come and then they say, where are the facilities for all of that? Okay, even if you set up a facility, then what about the report? Then again a 3-day wait for them. And then they cannot come back. They forget. Economically, they cannot come back. There's so many reasons. The stress of the family. So you see, if you have these things, at least they have a provisional waterhead. Next. And then we did this community-based medical education. Very necessary. So that was a classroom-based, and you're using all these tools here for your people. But the actual thing is to address the population of Pakistan. And we did this. We've done community-based medical education, and this is actually the key to eradicate disease at grassroots level. Next, this is just a table. I'm not going to go into the details how we did this for the breast cancer. So you see the other non-communicable disease. This concept was applied there. There was a community of interest. I mean, we are all just communities of interest. I'll be very honest. You just give them a lecture, they gather around October ka month, okay, the breast cancer, this, you exchange information, you give leaflets, we're going to social media, videos, and it's been taken up by the highest office. But then, where is the goal-oriented community? Jab tak community doesn't come forward, then there's nothing. So then, we did a pilot on a certain set of women, and from them, we made a goal-oriented community that they imbued it, yes, we are going to have a screening. Even if we have a little bit of problem, we'll come to the Federal Breast Cancer Screening Center by the federal government. It's totally free of charge. And for free mammograms and ultrasounds of the breast. They didn't even go out the facility. And then the learning and then the community of practice. So now I've got leaders in the community, and the leaders of the community are now bringing in women. So women are bringing in women. Next, please. And so I'd just like to conclude the session by saying that, these are some of the innovations and development in the field of health technology. This is the way ahead in a populous country like Pakistan, with a population of over 220 million. And similarly, medical education, both at the community and at the health professional level, is essential to meet the increasing demand of industry and other stakeholders, and keeping in view, of course, the increasing economic costs and the large volume of technical and health information data. Thank you. That's it. Thank you very much. And this is work which is being done, which I wanted to share with you, and I hope you'll carry it forward. Thank you very much. Thank you.
Thank you very much, Dr. Aisha Sani. It's very nice and precise presentations. Before going to the next presentation, I ask the audience if you have any questions. You are requested to leave. The question is very short and precise because we have very shortage of time. So over to the audience if you have any questions.
Thank you, Aisha, for a very comprehensive presentation. Some of the work you have shared with us. Just to give a brief intro, my name is Mohammed Saad. I've recently joined the public health level first actually, and a country director. It's my first meeting, and thanks for the invitation to join this. My question was in relation to the trouble you had developed for the COVID-19 X-ray application. What the sensitivity or specificity or like compared to a radiologist reading that? Because I think it's quite impressive.
When we did an in-house assessment of our own self, honestly speaking, it is still a little higher, 85 to 90. So the radiologist at the current moment, but this is only a year's work down the line. So when there's more refining, we aim to have this at 90%, inshallah. Thank you.
One question, since I'm and I work as a professor of public health. What I feel is that clerkship programs at the fourth year, final year, we are really deficient in what we taught is we taught that ENT, gynae, hospital, and that's it. We all started at say in one city. But we lack few clerkships like lab medicine. Like a clerkship in the form of radiology. Our students never go to the radiology. The new technologies are just not these telemedicine or artificial intelligence. The new technologies are assistive technologies like oxygen concentrator. In my life before COVID, I haven't been able to see the oxygen concentrator. When I graduated from the graduate in 91, we didn't have any ultrasound facility. We just had one axis. We have never thought of it. So there are a lot of technologies now, MRI, CT scan, whatever you say. Our students, they are not aware of all these technologies and the uses plus the advantages. So what I really want is that at this forum, we should be deciding that in the clerkship program, we should have radiology clerkship, we We should have the lab medicine clerkship. So these are very important things. And plus artificial intelligence, because without the artificial intelligence, you cannot screen the patient, because you see the X-ray, you don't have the back in mind what is going on. So you cannot screen the person, you cannot give them marks. I mean, so what we need is, we need to redefine our curriculum, which is syllabus been followed for the last 50 years, not change at all. So we need to redefine our curriculum, we need to redefine our syllabus regarding artificial intelligence, regarding the use of assistive technologies. So this is very, very important. China, what they did was, they did actually increase their knowledge about assistive technologies. China had made oxygen concentrators, you know, and these oxygen concentrators, they are really helpful in our primary wards, like emergency wards, where there's lack of oxygen. So then bypass and all the other things that you have the patients. So I really wish that our students should get this scholarship program, doctor radiology or the lab medicine in 4th year. So once they come to the final year, they're seeing the medical patients, they can then apply all these technologies. So that is my perspective. And thank you very much. It's a very good presentation, very nice. Thank you.
Yes, I have one question. What is the role of
Thank you for your answer.
So you have actually the Chinese, I think the best, they're way ahead of everyone else in the whole world actually. So in this, so what you basically diagnose it on the basis of X-rays and CT scans, the high resolution CT scans. So the thing is that you don't have enough HR, the manpower. And you're having a large number, you're having 100 CT scans, for example, a day, and you're having 500 X-rays, you do not have people. And they report it, but then the lag period is for 24 hours. Sometimes even like up to 48 hours in cases where the history is not here. There is what the AI will give you a provisional report, the doctor will at once know and start treatment, which will be, of course, endorsed then. By the radiologist, but at least you have the report, you can start, you can save lives. Yes, this is yes, the system and the software and generates that.
Let me add one answer more, because I've been going through all these COVID-19, I've been experiencing a lot of patients. Look, what is going on here? The first 24 hours are most important part of it, once you diagnose. And if in first 24 hours, you just have X-ray test, you can have this corner line and you can easily diagnose if the patient is chronic. So if AI intelligence, if that patient just gives us an X-ray test on WhatsApp even, and send us to it, we give them the report in 1 second. We can say, yes, it's corona, go on the corona. Yes, the people send us the radiographs on WhatsApp. And we do it.
Thank you very much, Dr. Ashtani, thank you very much. It's a long debate. Dr. Ashtani, thank you very much. It's a long debate. We will take a question.
We have one question from China.
Dr. Shabazz, you have a question?
Yes, from our side, we have one question. Director, the General Secretary, WHO Traditional Medical Sciences Foundation, Mr. Pan, have one question. He's asking that if we would like to have a cooperation with your institute for the public health and also for the artificial intelligence. And if we get this source of sponsorship or funding from the Chinese government, because we have done a lot of research in artificial intelligence and virtual reality and augmented reality. And we are very much looking forward for cooperation. So if you could give me a rough idea how much funding is needed to establish artificial intelligence institute at a primary level.
That's excellent. I can give you an idea, sir. I'll share that. I'll take your details from Dr. Tariq. And I've also got a PC1 page because I've just won a 19 million grant just for the COVID for the X-rays. And there's so much more need. That will be wonderful. Thank you.
Thank you very much, Dr. Shabazz and Dr. Ashtani. Ladies and gentlemen, now we move to the next presentation. The man on the screen, Dr. Muhammad Shabazz. I want to inform all the participants that we have a signed MOU with Wuhan University. Dr. Mohammed Shahbaz is the key person who did this thing. So now the next presentations is also given by the will be given by Dr. Mohammed Shahbaz. Dr. Mohammed Shahbaz from Pakistan is a surgeon specialist in minimally invasive robotic surgery from IRCAD, France. Dr. Mohammed Shahbaz got his master and doctorate degree from Shandong University School of Medicine. He is the founder of Presidents of China-Pakistan Medical Association, Executive Director of World Health Organization Foundation for Traditional Medicine and Research Fellow at QE Hospital. He is the ambassador of Silk Road Friendship, the contact person of Pakistani member units of Belt and Road Initiative Medical Education Associations of China International Cultural Exchange Center, the fellow of robotic surgery, Strasbourg in France. He is the founder of JCPMA, Journal of China-Pakistan Medical Associations, and the Sinovac Corporation in Vocational Technical Education, and CEO and founder of the project, the Health Medical Science between China and Pakistan, helping Pakistani medical students to participate in online training and promoting China-Pakistan healthcare cooperation. He has taught at various Chinese medical colleges in China and Pakistan. He has total 20 SCI publications with total impact factor of 92. He has written more than 150 minimal invasive surgery video abstracts and key steps on websites. He is currently working on a fellow of following projects: CPMA and China-Pakistan Medical Association, and Journal JCPMA, World Health Organization, Traditional Medicine Foundation, China-Pakistan Health Corridor, Pakistan-China Traditional Medicine Technical Training Program, CMU, WFPH, QE Hospital Cooperation with College of Physicians and Surgeons, and BRIMA, Belt Road International Medical Education Alliance, China, BRTMA, Belt and Road Tropical Medical Education Alliance, Sinovac Vocational Technical Education Cooperation. So over to Dr. Shahbaz.
Thank you very much, sir, for your kind introduction, and it's great privilege for me to be present the presentation about China-Pakistan Health Corridor. If you could allow me to share my screen so I can proceed. Currently, I cannot share my screen. Could you please allow me to share my screen?
Dr. Shahbaz, now you can share his screens.
Okay, yeah. No, it's still disabled. It's saying host disabled participant screen sharing.
Sure.
No, yeah. There's some technical problem. I think I cannot. Okay, now it's okay. Thank you. Yeah, I'm on. Okay.
Dr. Shahbaz, continue. Please continue. Now
Yeah.
it's visible.
Okay, so thank you very much for the nice introduction. And today I'm going to introduce China-Pakistan Health Corridor, the state of the art, the program, what projects being done, and what are the challenges and the future of China-Pakistan healthcare cooperation. It's been great privilege to have signing the MOUs for cooperation between China and Pakistan at various forums, especially for the digital medicine and WHO traditional Chinese medicine and WHO traditional medicine cooperation, and also between China-Pakistan Medical Association and Health Services Academy. And I've been working as the president of China-Pakistan Medical Association and chairman and founder of China-Pakistan Health Corridor. So these are the various organizations I have been working with, and China and Pakistan are celebrating 70 years of diplomatic relationship this year. And these are some images from the history of China-Pakistan diplomatic relations. This is the first ambassador of Pakistan to China and the latest ambassador, Mr. Moinul Haq, His Excellency. So,
Dr. Shabazz, you are not audible.
So I was awarded the Ambassador of Silk Road Friendship Award last year by the Chinese government. I've written frequently on the China-Pakistan diplomatic relationship and healthcare cooperation. And I put forward the idea of China-Pakistan Health Corridor in 2017 in Hong Kong University Faculty of Medicine. The main idea is to connect the Belt and Road countries by the regional healthcare center establishment, which consists of hospitals, IT and big data, medical universities, advanced training center, nursing and paramedical institutes, center research and development, entrepreneurship centers, and medical device and innovative centers. All these can be connected with the mobile hospitals and telemedicines and big data. So why we need the health corridor? This is the data of Pakistani physicians and doctors from the Pakistan Medical Commission, latest to the data, which says that there are 281,000 Pakistani doctors, and the number of beds you can see is 114,000 beds are available in Pakistan. So the hospitals is the officially is 1,300 hospitals available in Pakistan, and there are some 700 private hospitals. And in Pakistan, if you see the number of doctors registered with the PMC, there are 782 people have access to one doctor, and 6,868 people have access to one specialist doctor. So there is a still need of training of medical doctors, and also there is still, we need to produce many doctors and skilled doctors which can fulfill the requirement. So according to the College of Physicians and Surgeons of Pakistan, the data shows that there are 32,030 specialist doctors, out of which there are 22,607 are FCPS and 9,433 doctors are MCPS, members of college. So there are a number of projects which are done by China-Pakistan Economic Corridor, and there is only one hospital which is going to be established in Gwadar with about worth of 100 million, which is still quite a small hospital, and as compared to the China-Pakistan Economic Corridor projects. So if we see at the China healthcare database and the facts, we can see that there are 8 million healthcare workers in China. There are 27,000 hospitals and 1 million surgeons, 6 million nurses, and 5.34 million hospital beds. China have a big infrastructure of healthcare, and we, as a friend of China, we can have a collaboration with China. We can develop in the healthcare sector, in the technology, and in the infrastructure. Here you can see the China healthcare expenditure and the pharma industry growing year by year from 1990s to 2012, 2014 years. You can see the constant development of the expenditures. Here is the data of Pakistani students and the foreign students who are studying in China. Due to the COVID, there's a number of doctors and the students have already gone back, but this is the latest data available till now. It shows that Pakistan is the number 3 ranked by the number of students studying in China. There are 28,000 students who are studying medicine in China, and Pakistan ranked number 3. And the number of medical students in China count 13.8% of total number of students, which is 67,921 medical students. And Asian students coming to China are 295,000 and African students are 81,000. China is providing a number of scholarships to these students. The scholarship count 12.81% and the other are self-funded students. China is spending a lot of money on the research and development, and there are a number of collaboration which has been done between China and Pakistan. Recently, there is the sister university cooperation between China and China Medical University and King Edward Medical University was established in 2018. And there is a China Medical University and King Edward Medical University signing MOU, and the high-level delegate from China visited CPSP headquarters in Karachi. And also there is a collaboration between the cardiology center established between China and Pakistan in Shanghai. Also, there is a number of collaboration and MOUs have been signed between China, Pakistan, and especially between the College of Physicians and Surgeons of Pakistan, King Edward Medical University, Services Institute of Medical Sciences, Fatma Jinnah Medical University, and from the Chinese side is Fuwai Hospital, the best cardiology hospital in China, Weifang People's University, Weifang People's Hospital, and Tezhou Medical University, and Hainan Medical University, and these are different collaborations which have been signed. So there was a breakthrough in 2019 where the Nishtar Medical, the Bahawalpur Medical University and Xi'an Jiaotong University, they signed a Sino-Pak Joint Lab Research Program, which was established in Xi'an Jiaotong University. And every year there are around 10 scholarships which are approved for Pakistani students at PhD and master degree level by this lab. So these are different news about the collaboration, and the Nigerian ambassador, they also approved this project, and there are different traditional Chinese medicine trials which have been done in Pakistan with the Karachi University and the different medical institutes of China. And Pakistan first domestically engineered ventilator, which was also developed, and we are also having the collaboration with Chinese medical universities and institutes, especially with the traditional medical sciences. Some training activities and trainings program were done last year in Qingdao online. So this is the Belt and Medical Institution and Application Alliance. Why we need this alliance? This is a very important part to combat the pandemic. So China successfully battled with the pandemic, and now in China there is number of cases have declined in single digit. China also have done a lot of research and infrastructure and medical equipment, technology development. Innovative medical devices, the second chapter China have done a lot in the medical devices innovation and development, especially for the production of masks, gloves, test kits. We have a lot of operation telemedicine and telesurgery and advanced operating rooms and diagnostic labs, which can be established by the cooperation of China and Pakistan and Belt and Road countries. We can also establish these hybrid operating rooms and operating diagnostic labs in Pakistan. So this 3D imaging and virtual and augmented reality, which we can take advantage of the artificial intelligence also in robotic surgery. So also we can have a cooperation with the artificial intelligence and big data, advanced medical technology, 3D printing, personal sensors. And this is the last year when the Chinese teams of doctors visited Pakistan, King Edward Medical University, and King Edward Medical University are invited all the faculty of medicine and Pakistani doctors, leaders of healthcare professionals to have a meeting and discuss about the collaboration. And also, this is the first time the four Chinese professors and leaders, they were awarded the fellowship from the College of Physicians and Surgeons of Pakistan. And the ceremony was held in Lahore in 2018. So Pakistan is doing a lot to combat the COVID. National Command and Operation Center, NCOC, and Pakistan government with collaboration of Chinese government, the phase 3 trial of the vaccine were done in Pakistan, and Pakistan also have developed PakVac with collaboration of China. China have artificial intelligence software infrastructure. We can have a collaboration for the artificial intelligence with China to combat not only the COVID and also other diseases. So here you can see in China, there is all the airports, all railway station, all the places they have to follow this green code and yellow code and red code. So this all the COVID controlled by China using this technology. So we can also have the mobile medical facilities and mobile hospitals and Belt and Road Medical Force. And in order to fulfill this, the project, the initiative, we launched the China-Pakistan Medical Association. This is the official website. So here is the Pakistan chairman and the China chairman of this association, Professor Nugin, and Professor Dr. Mahmood Ayaz is the chairman of association from Pakistan side. This association have been recognized by Pakistan Embassy and His Excellency Mr. Moinul Haq. And we also have launched the Journal of China-Pakistan Medical Association, and the chief editor-in-chief of this association is journalist Professor Liu Shuwei, who will be giving presentation after me. And we need the multidisciplinary link. The universities, hospital, IT, big data, pharmaceutical institutes, and training center we need to connect them. So CPM is a big platform, is the main platform to connect Pakistan and China institutes together. What are the challenges we are facing? And we are facing the language barrier is a big problem between China and Pakistan, and many people in Pakistan, they don't understand Chinese. And all the projects, they have a persistency and duration. And if there is a new government comes, they stop the previous projects and they start the new projects. And we need to have the platform and the institutes and high court technology, and we also need fundings from the governments and from from different institutes to run the projects. So in order to have this collaboration, today morning we signed different MOUs for a collaboration between China-Pakistan Medical Association, WHO Traditional Medical Foundation, and also the DG Human. And Wuhan University also showed intent for cooperation with the Health Services Academy. So it's a great pleasure to have a collaboration with the Health Services Academy for the healthcare cooperation between China and Pakistan. And we also have this on-board World Health Organization for Traditional Medical Foundation and DG Human. And we are planning to establish digital medicine labs across Pakistan to make the digital medicine and the use of virtual reality and augmented reality, the artificial intelligence use in the operating rooms and anatomy and in surgeries across Pakistan medical institutes. So I would like to thank all the faculty and all the organizers, and especially Professor Lu Shubey and Professor Shehzad Ali Khan, Vice Chancellor for Health Services Academy. And I would like to take this opportunity, and I wish that there's more cooperation between China and Pakistan in the healthcare sector. Long live China-Pakistan friendship. Chompa Yoi Wansoe, Chin Pak Dosti Zindabad. Thank you very much. If you have any question, kindly please ask me. I'm here to answer.
Thank you very much, Dr. Shehbaz. And now the next presentation is next presenter is Pan Wenz. Mr. Pan Wen from China, Executive Director of World Health Organization Foundation for Traditional Medicine and Director of International Cooperation, China International Cultural Exchange Center, and Executive Director of CPMA. China-Pakistan Medical Association has been involved in a number of international cooperation projects between China and Pakistan, among which the heading projects are World Health Organization Traditional Medicine Foundation, China-Pakistan Health Corridor, Pakistan-China Traditional Medicine Technical Teaching Technical Training Program, CICEC Mobile Hospital Telemedicine Project, World Academy of Traditional Medicine Sciences. Now, Dr. Shehbaz, I request to ask Mr. Pan Wen from China.
Yes, he's coming here. Yeah, he's coming here. Please. I'm going to share. I'm going to share my screen, and he's going to present.
Okay.
Okay, here we go. Yeah, please. Come.
Yes, good evening. It's 6 o'clock in Beijing now, in Jinan. And Your Excellencies and distinguished guys and head of universities and ladies and gentlemen, good evening. I'm Wen Pan, as Secretary General of WHO Traditional Medicine Foundation. And now I would like to share my presentation to all of you, my friend. Yeah, as you know, the traditional medicine is the main pillar of health care services and an important part of the health care. On the May of 24th, 2014, the 67th the Health Assembly of the World Health Organization was held in Geneva, Switzerland, at which the WHO strategy for the traditional medicine.
We have to interrupt you. Please, your slide, please go to the slideshow. Your slide is not moving.
You're not showing?
Please
Sir,
go
no?
to the slideshow. Your slides are stuck.
Okay, wait. Yeah, is it working? Okay.
It's working?
Please press enter, please press enter. Please go to the slideshow.
Yeah, it's working. Yeah. Yeah. Can you see the move? The next slide?
No, we can only see the first slide.
Okay, I'm going to share again. Yes, okay, you can speak.
Yeah.
Can you see now?
No.
Sir, could you please display this presentation from your side?
Okay. Please send it through WhatsApp. I will try to.
Yeah, last night I already sent this one. Wait.
Yes, I take my laptop.
Now is it working or not?
Oh, it's okay. It's visible. Please start.
Yeah, okay, no, it's okay. Okay. Yes, it's okay, working. Okay, let's.
But click on the slideshow.
Okay.
Please click on the slideshow.
Here? Okay.
Slideshow. On the right corner, logo of the right corner.
Okay, please.
Yes, a second. Yeah, and okay, continue. And the 2014 to 2023 is proposed by China and other countries was considered and adopted. As a result, the WHO Traditional Medicine Foundation was officially established.
So kindly tell me if you can see the new slide.
No, Rashma, I think they use the two screens. Ask them to use only one screen.
Okay.
Maybe.
And there is no issue on our side.
Is it okay now?
It's okay now.
Okay, now it's okay.
That's okay.
Yeah, and check.
Okay.
There you go.
Okay, now I would like to share the purpose of the WHO Traditional Medicine Foundation. Yeah, the purpose is the first we would like to carry forward the contribution of the traditional medicine to help save lives and improve health. Yeah, for the foundation is concerned about the development of the traditional medicine. We will continue to raise funds, promote the contribution of a traditional medicine to individual and the health well-being, the help save lives and improve health, and promote the universal health coverage by playing the role of the service, communication, and collaboration and exchange. Yeah. And now our mission is we have 4 missions now. The first is the WHO TMF assists the member countries in adopting and implementing the national work plans all for the traditional and complementary medicine to intended traditional medicine into the health service system. The second is the WHO TMF assists the member countries in formulating national policies, standards, and regulations to strengthen the capacity building of a traditional medicine service for the development of traditional medicine. And the third, assist the member countries in preventing the guidance on regulatory and quality assumes standards to improve the safety, effectiveness, and quality of traditional medicine. And also we will assist the member countries in promoting the correct use of appropriate traditional medicine by technology. Okay, no problem. And all the responsibility of the WHO Traditional Medicine Foundation. And please have a look. And we will focus on the formulate and important traditional medicine policies and regulations, and also the guide of the supervision of herbal products and formulate the standards and so on. Please have a look. And for WHO TMF, the development planning, please have a look. This is the cycle map. The WHO TMF as a platform. And the first, we will set up, we would like to set up the Academy of Traditional Medical Science in 100 countries. Yeah. And second is we would like to set up the global medicine traditional platform using the international herbal medicine treating. And the second is set up the rehabilitation center in 100 countries who already has the Academy of the Traditional Medicine Science. Yeah, and the fourth is set up the pharmaceutical processing base, the global distribution system. For WHO TMF, the development, the planning. For the pharmaceutical, processing base. Yeah. Yeah, and for set up the Academy of the Traditional Medical Science, we plan the sponsor from the three parts. The first is from the state policy and the capital. The second is from the WHO TMF. The third is from the overseas Chinese Chamber of Commerce capital. We would like to cooperate with we would like to cooperate with the traditional hospital, universities and colleges, and the medical research institute, yeah, and so on. Now we will see some opportunities of the world traditional medicine, and with the COVID-19 and the increasing number of the cases, the countries have made a great achievements in prevention and treatment. However, the rehabilitation of court case has not been paid. Okay, and now I would like to share the two cases. One is for Wuhan, COVID-19 in Wuhan. And the Chinese traditional medicine effective rate of the traditional medicine is more than 90%. The second case is the Delta. Is the Delta is of in Yangzhou. We use the traditional medicine only 2 weeks to control the Delta. We would like to cooperate with Unani traditional medicine, and the Chinese traditional medicine have been strongly by the Chinese people and the Pakistani people. Yeah, we have 5 aims. Yeah, to need to complete. Yeah. The last one, our President Xi said support the Belt and Road and Pakistan and China health corridor in the future. Thank you very much. Yeah. Yeah. If you have any questions, please.
Thank you very much for a very nice presentation. I have one question regarding the traditional medicine. Regarding Wuhan experience, can you share what the traditional medicine helped in Wuhan case?
Okay, that's we call the 莲花清瘟. We call the 莲花清瘟颗粒.
This is the Chinese
Chinese medicine.
Pardon?
It's a Chinese medicine. Chinese traditional medicine. It's called 莲花清瘟.
Again, whatever is the Chinese traditional medicine, how did it help the Wuhan COVID cases? You know, I mean, I just want to know what kind of traditional medicine you use in the Wuhan for the COVID patients.
So, you know, for the 现代医学, the Western health is using the medicine. They will fight in your body, okay, in personal body. But for Chinese medicine, is using the Chinese medicine. How do you say 排除这个毒素从身体排出去，然后在外边打。
So the main difference between the Chinese medicine and the Western medicine is that the Western medicine only treat the virus, but the Chinese medicine not only treat the virus, also detoxify the body from the harmful viruses, bacteria, and the harmful effects, and regulate the immunity and strengthen the immunity of the body.
डॉक्टर शहबाज मैं आपको उर्दू में इसलिए बात करने लगा कि पाकिस्तान में भी बहुत ट्रेडिशनल मेडिसिन लिए इवन मिट्टी और सना मिट्टी और whatever they have done, and hence it has not proved any role in preventing the COVID-19 in Pakistan. So how do the Chinese, how can they prove that this traditional medicine had done? Are there any research on it? Or they have got some valid data? So that's why we can do it. Because in Pakistan, whatever traditional medicine the people use, it do help, but it didn't cure COVID.
Do you have
Like,
any?
actually,
Yes, we have some plan and share the Chinese medicine fund, how to say the medicines. We have maybe 10 or 11 medicines boiling together and share to the people, have a drink.
So later, I think the Professor Li Hao from the Wuhan University, after the Professor Liu Shue will have this the presentation, and he can give more highlight more this about the traditional medicine about this.
I'd like to add one thing. The team from Wuhan had come, and they were with their military doctors, and they had taken our sessions in NIH here next door, and they gave us a session on the traditional medicines and all that. Maybe that is what you'll tell us next, but we have that set of tutoring by the Wuhan team done here as well. Thank you.
Thank you.
Thank you very much, ladies and gentlemen. So now we next presenter, Professor Hu Li, Associate Professor at the Department of Global Health and Global Health Institutes, Wuhan University, Public-Private Academic Partnership, PPAP, a model for Sino-American collaboration with health. So I request to Professor Hu Li take only 10 to not more than 10 minutes. Please conclude your presentation within 10 to 15 minutes. Thank you very much.
There's another professor, is Professor Liu Shue Wei. I think you have missed. He was the first one to present. So I think after the Professor Li Hao, you can put him online.
Okay.
Yes.
Okay, thank you, Chair. Could you please let me share my screen? Currently, I'm not allowed to share my screen. Let me see. Yes, I cannot share my screen.
Dr. Shibaz, the host, I request to Dr. Shibaz, please allow him.
Dr. Chair, I cannot share my screen. So maybe Mr. Pan Wen need to cancel the screen sharing. Can you hear me? Can you hear me?
Yeah. I already cancelled from my side. Professor Li Hao is in different place. He's not with us. So kindly allow the Professor Li Hao to share his screen.
Yes.
Can you share?
Yeah, I can hear, but I'm not able to share my screen.
So maybe there's a technical problem. So if you can find out the.
It say I don't have the privilege to share my screen.
Sir, if it is possible, if then Professor Liu can come first on it. I think. I off.
Maybe I can be the last one to present.
Okay, okay. The Professor Liu Shuwei can go on now. I think so. If you have a. So you can try again. Try again. Can you share, sir? Please check. Sir, you can send your slides to me. I will put on. Professor Li Hao, you can send your slides to me.
Yeah, yes, I've already sent it to you by
Okay.
WeChat.
Okay. 你把你的我的手机给我。I think first let the Professor Liu Shuwei can present first, and meanwhile I can prepare. Okay.
Okay.
Yeah. 刘教授，你先来。Okay, here you go. So you can come. Yeah.
Okay, good afternoon. Respected ladies and gentlemen, I'm very glad to be here to report the topics about establish an application of a high-resolution digital human sectional dataset. I'm Shui Liu. I'm from Shandong University, Qilu Medical College. We know that clinical practice need the high-resolution digital human body in order to reveal more detailed anatomical structures. Our purpose is to be obtain the high-resolution sectional anatomical dataset of a human body by using a digital 3D media techniques for establishing more practice clinical digital human. The first, I want to introduce the establishing the high-resolution digital human sectional dataset. We choose the 6 Chinese adult cadavers as specimen for these studies. After CT and MRI examination, verification of absent pathological lesions, the specimen were embedded with the keratin, anatomic position, and a freezing and profound hypersymmetry. The specimen was then seriously sectioned from feet to head, layer by layer, with digital modeling machines in the freezing chamber and 30 degrees centigrade. These hours, the labor are for creating the human data set. This is the procedure of file the data set of a human body. That is the rotation or rolling. It can part of the human body. Now we apply the section of the human body. And we find that the first section data set, I need the 4 minutes. At first, we can see that the tone clears in the base of the specimen. Now we use the cleaner. We can bring the anatomic of the body. Okay, the sequence imaging was captured by a means of digital linear scan cameras. As the data set was imported to Illinois workstation, the high resolution digital human bodies was created by our digital data sets. Okay, this is we show the serial section of human bodies from the feet to the head. That is leg sections. And is the intersection of the oh. The intersection of the knees, the eyes around the human bodies. Then we can see that is the time. We can see the pelvis and the abdomen. There is a section, the thickness is 0.1 millimeter. For thoracic, the breast, and then the neck, the head, and then the brains. Well, the thing that the serial section of the human bodies and up to more than 16,000 layers, which easily being 0.1 millimeter in thickness. The picture solution was 16,000 times 26,000. This picture is show the section of through the head and the neck of the femur, and now we can see a lot of anatomic details. Now we can see there is the kidneys. Now we can see that the fissures or garroted fissures were clear. That can be seen. Okay. Then we can see the periphery of the livers. We can see the very liver capillaries of the bile duct, and there's a portal cavern and the portal veins. At the peripheral part of the lungs, you can see very little capillaries of the lungs. Now this is the section through the brainstem. Then we can see a lot of nucleus can be seen, and there is a dental nucleus of the cerebellum. And the pelvis section, and we can see the uterus and the head of the femurs. This structure through the pancreas and the liver, the pancreas. Then we can see the can keep the color of these sections. And this is a section through the fold. You can see the very smooth, very smooth section. Then there is the bone and the muscles. At the same time, also through the bone of the feet. And this is through the internal intervertebral disc. You can see the section is very clean and very smooth. That section that kept the original color of these specimens. Okay, that is the fresh, the knee joint. You can see the very clear. It's a brain. A lot of anatomical details. The color, the gelatins into the arteries, and the blue the gelatin into the vein vessels. As we can see, the very little arteries in the veins. And it is very little artery in the skin can be seen in these sections. Another section of the male cadavers. This is the leg of another cadaver. Okay, that is a very young people who can see the cartilage. There are also cartilage of young human bodies. Okay, the methodological reported here will greatly improve the milling method parasitic graft. It's the new data set acquisition method for section anatomy and digital human bodies. The thin section anatomic data set of a human body of antibodies techniques that offer high precision and good quality for established clinical digital human with high resolutions. The second part introduced the application of high resolution digital human section data set. Reconstructed the system for digital human teachings. That is English cartilage. Okay, there's also is shown in the cell phones. It also can establish the digital anatomical label for teachings. Then it introduced a new progress of the high digital human bodies. Then this picture can show a lot of detail of anatomy. It can give the sections, coronal and sagittal, and another the planes. Okay, it also we can the AR digital humans. The Chinese students can use this system for learning the anatomic knowledge. In our universities, the students use the system to for learning anatomic the knowledge and the dissectors and human bodies. This picture can show that we can the multi-planar reconstruction for these sections. It shows the model of the hand. It shows the sectional coronal models, 3D printed. This human body, it can hang the labels. It can see the section very easy. Also, the people can see the human section very easy in his labels. Recently, we combined the color atlas of a digital human cross-sectional human head and neck and all the human bodies. There is we printed the softer models of human brain and hand, but the bone is hard. So this research is guided the founder of a Natural Science Foundation of China and the Science and Technology Foundation of Shandong Province, China. And to the human technology company in China, we also give him acknowledgement. Okay, thank you.
Thank you, Professor.
Okay, thanks.
The next presenter is Professor Hu Li.
Yes, okay. I'm going to copy your slides.
Professor Hu Li is Associate Professor of Department of Global Health and Global Health Institute, Bonn University. Over to Professor Hu Li.
Thank you very much.
I'm going to put on time. I'm going to see your slides.
First, I would like to respond to some of the questions previously raised by someone about the traditional Chinese medicine. So what is the mechanism to fight the coronavirus? So according to current literature, traditional Chinese medicine help to improve the immune system of the body, which can work to fight the virus. The second is that the traditional Chinese medicine help to constrain virus duplication speed. And the third is traditional Chinese medicine can facilitate the body to expel the virus out of our body. So this is what we can find in our literature about the mechanisms. So, and however, there are still more research to be done. Maybe we should do the clinical trial research together, or there is a debate as well when we do clinical trial about traditional Chinese medicine. It is not Chinese medicine as well, because it is using the Western medicine way to study a traditional Chinese medicine. So maybe we need to explore our own way to verify the effectiveness of traditional medicine. Okay, and now let me present my presentation. So the topic is public-private academic partnership, a model for Sinopac collaboration in health. So currently, Pakistan and China have developed a long-term friendship for many years. Pakistan is the only nation with China for all-weather strategic partnership of cooperation. So with two countries, we have done plenty of people-to-people exchange. Dr. Muhammad already introduced that there are huge medical students studying in China. And also China is Pakistan's biggest partner in foreign trade. And also China has huge investment in Pakistan. All this based on must be based on a very good relationship. The second one is that currently the Belt and Road Initiative is having more impact on regional and global development. And the COVID-19 has been profoundly changing international health and global health governance. So China has done our best to share our experience and provide assistance to other countries, and especially with collaboration with Pakistan. So currently, Pakistan is enabled a local production of vaccine, and this has contributed to not only the safety in Pakistan, but also the whole South Asia region. And and also between China and Pakistan collaboration, currently we have the economic corridor. From here, we can see that there are a lot of projects going on in energy, in transportation, in infrastructure building, and in industrial cooperation. And there are a long-term plan for China-Pakistan economic corridor. There's a plan from 2017 to 2030. It is expected to invest $46 billion at the very beginning, and now it has increased to $62 billion this year. And the CPEC has been implemented in 3 phases. First in the economic and social development, and then the industrial growth and agriculture. So the collaboration is in all aspects. So this collaboration make Pakistan can focus really on its own development. And China and Pakistan has collaborated for years in health as well. In health, when we talk about foreign trade, we talk about industrial collaboration, and we have to make sure that the society should be healthy. So the country should be able of fighting the infectious disease and communicable diseases. And in 2006, the health authorities of 2 countries signed an integral health cooperation document in clinical training, traditional medicine and public health, prevention of virus disease, surveillance of infectious disease, and ICT health. And also in 2020, we have worked together in all aspects to fight the virus. And here are some examples about outstanding health collaboration between China and Pakistan. The first is eye health, and the second one is e-health. Currently, the China Mobile International Company has operating the 4G in Pakistan, and also currently Pakistan is enabled to local production of COVID-19 vaccines. And during the current COVID-19, 2 countries have collaborated in experience sharing medical products supply, and also we exchanged our experience in how traditional medicine can play a role in fighting the coronavirus. And also in Pakistan, traditional medicine has also been used to fight the virus. But currently, there are a lot of the health system has yet to be strengthened, making it more capable of prevention, control, and treatment of both communicable and non-communicable diseases. So up till now, all the collaborations have paved the foundation and for us to release the China-Pakistan Health Corridor initiative. And in the collaboration theory, there are 4 typical collaboration models. The first one is very typical, is public-private partnership. And the second one is public academic partnership. The third one is private academic partnership. And this partnership normally normally involve just a very few number of actors to collaborate, and especially there are just two sides to collaborate. So currently a new model is coming into being, and that's a private, that is public-private academia partnership. But about this collaboration, the participating parties have yet to be increased. And so currently there are a lot of challenges for us to collaborate. Both Chinese and Pakistan companies are not familiar with the politics, economics, society, and technologies certain in the other country. And most private Chinese companies are small in scale, and lack funds and policy support from bilateral governments. And the partnership is usually at an individual level. There lacks of a platform and to incorporate many actors to play. And their lack of multidisciplinary background staff who knows not only medicine and public health, but also knows health economics, management, and policy generation process. And also in China, there are very limited number of social enterprises to play in Pakistan. So all of these challenges make it necessary for us to develop a platform, and so that all the stakeholders can play together. So here I've proposed updated PPAP model. We can say that in this model, in this platform, all the stakeholders, mainly three main entities: the governments, the industry, and the academia can all participate in this platform construction. And also there are other participants as well, such as the WHO Traditional Medicine Foundation, for example, and other international organizations and social organizations. They can also join the platform. But after that, the seed projects should be invested so that all some of these actors can work together on a specific topics to do research, to do implementation, to do policy transformation, and even to do a dissemination of the results. And also in the platform, there should be a specific organization and to manage all these activities. So in the organization, there should be a secretariat, a technical department, project management department, evaluation department, and etc. So if we can work together to build this platform, then we can start with some priority areas for collaboration. So I propose some priority areas in 4 parts. The first one is in health security. So it is a very basic condition, and to make sure that two countries can do normal trade, can work and collaborate normally. So currently, it is very important to do research about the equitable access to COVID-19 vaccines, and and also we need to summarize Pakistan's experience on eliminating polio. And Pakistan is doing a very good job in this, but and it is neglected to summarize the experience. And also it's important to do research about the cross-border risks of transmissions of communicable diseases. And the second area is health system strengthening. So we've already done a lot in this area, such as education and training of public health professionals. We can also do comparative study about rural health. In China, we have our experience in rural health system. We use low cost to achieve a higher performance, and also we can collaborate with a traditional alternative medicine. Maybe Pakistan can use the same protocol or a similar protocol of ours to verify the effectiveness of how the traditional alternative medicine and plays an effective role to prevent and treat the COVID-19 and patients. And the third area is health industry. So we can continue to do research about how to do better trade in pharmaceutical products, how to enable further enable digital health. So in China, we have very good basics, very good technology, and managing experience as well. And currently in China, when fighting the coronavirus, not only digital health played a very good role, but also the traditional Chinese medicine as well. And we can do research about local production of medicines. So China has enabled many local production in other countries, such as in African countries. So we can also start this and to make sure how can we do it better and to enable local production in Pakistan. And also there are other areas there we think are basic to for the stakeholders to learn, and such as the past study to study the very basics of the politics, economics, society and technology setting. And also currently we can do, because Pakistan is adjacent to Afghanistan, we can do some research about the dilemma of the population health in Afghanistan. So as we have the platform, we can, if we can find the interesting actors, we can, the platform can make them contact together to formulate some seed projects to start with. And how to enable the collaboration? I think the following 3 steps are very important. The first one is the universities, enterprises, NGOs, think tanks, media, and other stakeholder actors can join a widely recognized platform. And currently, the China-Pakistan Health Corridor can be the PPAP platform to start with, and supported by both countries. And then the stakeholders can invest seed projects or programs to trigger multi-actor collaborations. So to do the following research, previous mentioned situation research, past research, and we can also organize seminars and to formulate policy briefs, to do interventions and implementation together to evaluate the effectiveness of the projects and disseminate the outputs. So if we can do this in this way, we are in the right track to build in a better shared future through the health corridor. So this is my main presentation, and thank you very much.
Thank you very much, Professor Holy. It's very nice and informative presentations. Now, I think I'm highly grateful to the speakers. Now we are able to conclude the session in times. Now we ask the audience if they have questions. We give request to audience, please ask the question, very precise questions. Audience, anybody have questions?
I have a question. So I'd love to do an initiative with you and use the base either from Health Services Academy or where I work at Pakistan Institute of Medical Sciences or the program. So you know how to get across to you and put across some proposals. It can be artificial intelligence, it can be other than that, and maybe have it integrated in the CPAC thing. That would be the best. If we could do it, that would make it sustainable and good for the country and the people. Thank you.
Thank you. Actually, for years we have been exploring the collaborations between our team and our international partners. Previously, we have collaborated with Nepal, and we have implemented 5 projects there. I think it can bring some clues to strengthen our collaboration. 1 month ago, we have already discussed with HSA about our collaboration, and also supported by our university. Later on, we can explore the establishment of a joint center, and based on the center, we can enroll a master's student and PhD student, so they can study in China, and also from our university, they can invest, provide some seed projects for us to start with. So when students have finished their courses in China, then they will go back to HSA for intern. So at that time, based on our agreed protocol, then we were able to do the comparative study between China and Pakistan. And also we can also collaborate together to apply to write a proposal and to apply funding from our government and from open sources as well. So and if we can get a grant, so we can start as a project. So we can organize many seminars. We can have field study. We can visit our government to do interviews. We can find ways how to make our research output into policy brief and have impact in policy. So previously, after we have done our research in Nepal about the dissemination of traditional Chinese medicine culture in Nepal, then later on, President Xi Jinping went to Nepal. So at that time, I think some of our suggestions has been adopted by our government. So I think we can do the similar exploration in the future.
Thank you, Professor. Dr. Shahbaz, you are with us?
Yes, I am here. Yes.
Thank you very much, Dr. Shahbaz, Professor Xiu Li, and Professor Mr. Pan. But fortunately, we have a shield and bag for you. But we now we can't send you. Inshallah, when you visit Pakistan, we will provide the shield and the bags.
Thank you very much. It's a great pleasure to receive the online shield, virtual shield, we say, and we are looking forward for more cooperation with the HSA. And just now, Madam was saying about the contact. about Professor Li Hao. You can get all the contact details from the Chinese counterparts and Chinese medical institutes from the Vice Chancellor and the faculty. So we have all shared all the contacts. We will looking forward for more collaboration.
Thank you.
Thank you very much. Now I request to our chair, Dr. Professor Anam, to conclude for your concluding remarks.
Thank you very much. Very cognizable presentations, and especially Professor Li Hao's was excellent. My little bit I'm curious because starting from Professor Shahbaz, everybody is talking about doctors. Nobody has talked about paramedics, midwives, LHPs, and all the other assistant which are working in all the healthcare setups. Do you think we can collaborate for the nurses to go to China and have the training or whatever in this regard, LHPs, midwives? We can have public-private partnership, or we can have academic-private partnership in this regard. So,
Yes. So I personally think, in 2017, once I put forward the idea of China-Pakistan Health Corridor, whereas we have a China-Pakistan Economic Corridor, I put forward the idea of China-Pakistan Health Corridor. It was approved by the Chinese government already. And we are looking forward not only the doctors, we have the paramedical and nursing department, IT department, and research and entrepreneurs and training center all put together in one platform and then connect them with the telemedicine. Now the problem is, as I mentioned in my slides, the only problem is language barrier between China and Pakistan. We need to train our doctors and we need to establish some kind of centers which we can have a collaboration at higher levels, and we can have a public-to-public partnership, and we have a public-private academic partnership. So we are trying to establish this kind of platforms in collaboration with the different universities in Pakistan. So I'm trying to connect the different universities of China and different universities of Pakistan. So if we can overcome the language barrier, there are so many fundings from China. We can get sponsorship for the scholarship for Pakistani students, nursing staff, and also the paramedical staff. They can come over to China, or we can establish some kind of centers, state-of-the-art centers in Pakistan with the Health Services Academy, with King Edward Medical University, with Service Institute of Medical College Sciences, and even with some private institutes like Aga Khan Medical University. We can do it, and it's the great initiative, and we are on the right track. Yeah.
thank you very much. I think with this I conclude this session. And thank you very much again for the participants and as well as all the people who are sitting here. Thank you very much, Dr. Aisha. Thank you very much.
I'd like to say thank you very much. I think this was a marvelous opportunity, and I think one of a kind. I think the best session, Dr. Tariq, in the entire conference. I represent the Ministry of Health in Pakistan. I'm a focal person for a number of things, and I'm associated with the ministry on various projects. So I think I'm there with the Ministry of Planning and Development also, and I've got all my links there. So please do utilize me, and let's go ahead with this corridor on health. I think that's the way ahead. Thank you for me.
Thank you very much.
Thank you. Thank you.
Thank you very much, participants and speakers. All I exclusively thankful to Dr. Ismail and Hamza. I exclusively thankful to Dr. Ismail and Dr. Hamza. This event is not possible with these two guys. So I'm highly grateful to these two doctors. Just a few minutes, small short summary for shadings and go for.
Okay, Professor Li Hao, I think we can log out, and I think.
So yeah, I request you.
Thank you.
Okay, we are online. Okay, we are looking. Yeah.
I request you, Dr. Inam.
बताइए Come get out. That's not Pakistan. Say it's from Pakistan. Okay.
बस याद करिए इनको क्या पीछे हो यार
Thank you very much. Thank you. I'm looking forward to take it once I'm in Pakistan. Thank you very much. I will visit the Family and Planning Commission.
Yes. Second is, I request you, Dr. Aisha Sai, to present the shield to Professor Dr. Aino. This shield for the professorship, Professor Hu and Cham, professors. And
Thank you.
I request you, Chair, please present me. Thank you. This is again Shehbaz. Yes.
Thank you very much.
Yes, sorry. Yes. Thank you. Thank you so much. Thank you, Dr. Shehbaz.
Thank you, sir. Take care. Have a nice evening. Good night. Take care. Good evening. Bye. Thank you.
William, look forward for more collaboration in the future.
Yes.
Yeah, bye.